Hello everyone, thanks for joining me for the ICSK Student Research Week. Today's presentation will be on knowing your worth in the healthcare field, specifically in the athletic training setting. My name is Rich Birdie, and I'm currently an athletic trainer at Wake Forest Baptist Health and Wake Forest University. I'd like to start with a brief introduction of myself. I'm currently employed by Wake Forest Baptist Health and Wake Forest University. My clinical day-to-day operations include the Care Consortium Concussion Research Coordinator, as well as an assistant athletic trainer with the men's basketball program. Prior to my time at Wake Forest Baptist and Wake Forest University, I worked at St. Francis University in Pennsylvania, where I was the Associate Director of Sports Medicine. This is where I received some experience in, proving your worth and how to develop a model to influence the administration that you work with. Prior to St. Francis University, I worked as a graduate assistant athletic trainer at Lock Haven University, which is also my alma mater. My education includes a Master of Science degree from California University of Pennsylvania, as well as Lock Haven University as a Bachelor of Science in Athletic Training. I've listed my contact email below in the event that anyone has any questions pertaining to this presentation or any questions in general when it comes to athletic training. Some other things that I did while I was in Pennsylvania. I was the Pennsylvania Athletic Trainers Society Young Professional Committee Chair, and I also served on the National Athletic Training Association District 2 Young Professionals Committee. The objectives of today's presentation is determining worth in the athletic training world, the value in athletic training. We're going to go over the NATA value models, the NATA salary survey, how to track injury encounters, return on investment, and then resources to help demonstrate worth. So obviously today's title is Know Your Worth. So the first thing we're going to do today is define worth. What is the definition of worth? So that would be the monetary value of your services that you provide. So typically this is more objective than subjective. You could think of it as the price tag of a service that you provide. And I think the underlying factor here is to understand the worth of a service, you must know the value of it. The worth of something is only valuable to someone that understands the value of it. For instance, in my day-to-day, so an ankle tape for an athlete that has a sprained ankle is worth much more than an ankle tape to a student athlete that does not need that ankle tape. Okay, like in the previous slide, I mentioned that to understand your worth means you have to understand your value. So the majority of this presentation is going to be about understanding your value and how to present your value when it comes to worth. Okay, so we're going to go through the definition of value. The extent to which a service's worth is perceived by its customer to meet the needs or wants of that individual. So how much value is the service you provide, and how valuable is it to your employer or the university you may work at, or how valuable is it to the athlete that you work with or patient population? Typically this is more subjective than objective because there can be a variety of examples of why something is more important to someone than something else or someone else. So we're going to look into some value models to help portray your value and your worth. And these are guided by the National Athletic Trainers Association, as well as some other resources that we can use. So we'll look into understanding your value. To understand your value, I think you need to understand your skill set, understand the skills that you possess that enable you to provide value to that certain employer or company that you may work for. Demonstrating your value through the use of the NATA value models. There are three: the secondary school, college, university, and the physician practice models. And then the tracking of injury encounters, evaluations, rehabs, and modalities. Decreasing in injuries equals decrease in insurance claims or money. And then the NATA salary survey. These are all things that we'll briefly go over. As an athletic trainer, our skill set is pretty diverse. We do a lot of things well, and these are some of the things that I feel are encompassed in an athletic trainer's skill set. So the first thing is education. When I think about education of an athletic trainer, I typically think of a master's level education in any one of the healthcare fields, and then they also educate their patients on what injuries they have, on how to rehabilitate those, on how to take care of it from a daily basis, day-to-day basis, as well as a home exercise program that they may take with them, or nutrition to psychology. Athletic trainers have a variety of skills in the education field. And then we go into risk management. Uh, I feel that athletic trainers are a huge proponent of risk management in terms of trying to decrease the amount of injury that is in a patient population. Prevention services, like I just mentioned, there are several exercises that someone can do on a day-to-day basis to help eliminate injury, just from even walking or acting or providing activity for 30 minutes a day can help decrease your risk of a majority of ailments. And then the organization and management services, especially if you're a director of something, you're dealing with this day to day. But even if you're not, I mean, the organization of the documents that you have to prepare just from an injury, the daily SOAP notes, the daily documentation of injuries and rehabilitations that you may do. So we're very skilled in that aspect, which leads me into rehabilitation and injury evaluation. Um, those are two things that we do very well, and we'll kind of show a little bit more on that a little bit later in the physician practice part of things. And then, also providing immediate medical care at events. We are typically the first responder, the first person on site for an injury. So I feel like we're very skilled in that asset. Athletic trainers have a variety of work settings. This can include schools such as junior highs, high schools, or college or universities. It can be in a hospital. It can be an industrial site, military site, performing arts, clinics, companies, organizations. Professional sports is another one that I forgot to mention. But we have a variety of settings that we employ athletic trainings in that kind of each have their own diversity in the skill set they may have. Okay, so we're going to move into the NATA value models. This is the part of the presentation that has probably the most significance when we're talking about knowing your worth as an athletic trainer, utilizing the things that the National Association provides for you and enables you to increase your worth and your value as an athletic trainer. So the value models provide a resource for value assessment for the athletic trainer in the settings that we spoke about. They also provide a global revenue strategy. So they took a look at a lot of the settings and tried to put a holistic approach on it to try to make sure it worked in a variety of settings. And then the value models provide a template for the athletic trainer to work off of to present to the administration. It could be any type of employment that you may think about or the ones we discussed prior. It's really detailed and task-oriented for the athletic trainer to demonstrate value to administration or those that may not know what an athletic trainer is. Currently, the NATA has 3 value models. These are located on the NATA website, and they are college and university, the secondary school, and the physician practice model. So we'll start by going through each one of the value models. So the first one we're going to go through is a college university model. I do have some experience with this at St. Francis University. I was charged with the task of providing a document that included the worth and the value of athletic trainers and how valuable they were to the university. This was presented to our administration at the university in the hopes of increasing salary and our staff. So I relied on the college university model pretty heavily. It's a very thorough document, but it provides clear and concise information on how to present this to your administration. So some of the main things that are in this document are the medical services that are provided to the student athletes. So as an athletic trainer, you're expected to evaluate and treat injuries, and then you're also expected to rehab and recondition athletes back onto the field or the court. You have the management of the medical services, which can be the medical team that you have around you, your supervising team physician, your neurologist, your dermatologist, your chiropractor, physical therapist. The list goes on and on. You're in charge of developing that team that you have, as well as your diagnostic testing. Your referral for X-rays or to the physician when it's deemed appropriate. And then your team physician series, which is the amount of team physicians that you may have. One may be specializing in family medicine and surgeries, upper extremity, lower extremity, neurologist, all those types of things you're in charge of developing. And then as well as your injury prevention programs on a day-to-day basis. This can range from you're on site with the teams and you're providing injury prevention in a warm-up. It can be in a rehab program that may happen once a week. These things can vary in the amount that they're used, but an athletic trainer can provide all of these things to your university or college. So the second thing was risk minimization. Like I mentioned before, athletic trainers are trained in the prevention of injury. So when we're talking about the prevention of injury, I think that's a pretty widely used word, prevention. I don't necessarily think we're going to be able to prevent an injury. In the event that something happens, we want to be able to try to say that we did our best to try to minimize the risk of injury, I think is a better way to put that. But athletic trainers are trained to determine and pick up those things that may increase your risk of injury. We're also included in our emergency action planning. We are the first person on the scene to be with a traumatic injury. If someone has, a severe laceration, we're the ones stopping the bleeding, or at least attempting to stop the bleeding before further medical assistance gets there. We're reviewing emergency action plans with coaches, other staff members, our physicians, the EMS crew. These are all things that athletic trainers are designed to implement. We have to maintain our proper certifications. So our licensure, our certification to enable us to be athletic trainers and, practice in the healthcare profession. And then also the pre-participation medical screens. This is pretty big in smaller universities. We're expected to complete a majority of that, and then the physician signs off on it. This can vary on the setting that you're in, but this is a value to your university. And then we go into our organizational and administrative value. I feel like this is one of the biggest things that we do is record everything that we do. This is pretty much the bread and butter of the college university settings, that we're providing a lot of free healthcare to our students, our student athletes that would be referred elsewhere, such as a physical therapy clinic. There's tons of day-to-day injuries that could be referred to physical therapy and be billed for, but athletic trainers handle that in-house. We maintain our professional license certification, PBEs again, develop a sports medicine team, emergency action plans, health and liability insurance, and we're also trained to educate our student athletes on drug education as well as complete drug testing with the appropriate personnel. So the last two things that the college university model spoke about were cost containment and academic success. Looking further into cost containment, they looked at insurance premiums. So insurance premiums for the university or the athletics budget, the sports medicine budget decreased when you increase your amount of athletic trainers on staff. And then we'll look at Professional liability insurance. Most athletic trainers do have professional liability insurance in the event that there is a catastrophic injury or something along those lines where there could be a lawsuit against that athletic trainer. You always want to track your injuries, make sure you document everything that you're either hearing from an athlete, you're seeing from an athlete, to ensure that you cannot be in a lawsuit. Then you look at your staffing and workload management. Sometimes in college universities there's 4 athletic trainers, sometimes there's 14. It depends on what setting you're at, and the workload can be different, but most of the time you have to manage that with appropriate personnel. Depending on where you're at in the setting you're at, Division 1, 2, 3, NAIA, any type of those settings, you have to be able to, fundraise some money for supplies, or, be creative with the budget that you have. Then they went into academic success. The biggest one I think out of this is, contribution to life skills and health and wellness. I think athletic trainers do a great job of educating their patients about injuries they have, and as well as how to get better, and just, day-to-day life skills were usually an outlet for anyone that needs it in terms of, mental health, and then receiving appropriate referral, or just, if someone has a question about their health and wellness, they usually come to us and they feel pretty confident in our answers. Okay, so we're going to go into the secondary school value model, which would be the high school setting. It has very similar initiatives as the college university, so we won't go through each of them, but the first is risk mitigation. So that is, is preventing your lawsuits and things of that nature. So how do you provide the most care to the most amount of athletes, which is tough. Usually there's only 1 to 2 athletic trainers in high school, so how to balance yourself and try to split yourself up into 2, which is, impossible, but high school athletic trainers, I feel, are the most adaptive to this type of thing. So, you have to do your injury prevention. You have to make sure your coaches are carrying that out to aid in the injuries. Your medical referral has to be on point to where you want to send them, as well as, parent communication. And then your practice and competition management. I feel like that's one of the hardest things that high school athletic training is, to show your face at every practice. You have your high risk sports, and I think that kind of delegates where you're at, but showing your face at a cross country practice is definitely appreciated by those athletes. And then your risk management strategies that you employ to your coaches and your administration, to help you out in the event that there is something tragic that happens or an emergency. Medical services, you guys can read what those are, but it's pretty much the same things that we went through before. I'm going to look through these and pick out some of the most important ones at a secondary school. Would be your emergency action plan, crisis management. These are all some policies that you should have in place to help guide your coaches or your administrators or even your parents on the things that they should be worried about or concerned about, and when to refer. Continuing with the secondary school model, the same 2 things are included in this as well: cost containment and academic success. Insurance premiums, I believe that would be more so on the parent, which would be helpful. Always trying to decrease the amount of money that you pay as a parent for your son or daughter for injuries is beneficial. In the event that your athletic department pays for any type of athletic injury, an athletic trainer would also help decrease the amount that you would refer out. Also, your staff workload management, same type of thing as in the college university setting. Typically in the secondary school, you have to be there a little later because students are in school, and then typically you're there from around 3 to whenever the last practice may be. Budget management. The budgets are significantly lower at the high school setting, so fundraising becomes more and more important if you need supplies or anything along those lines. Academic success. There's definitely some high schools that offer a sports medicine class, which is helpful to those that want to learn more about the sports medicine or athletic training world. And then your life skills. As a teenager, you have a lot of things going on, and you look at your athletic trainer, and they try to help you out if you have any questions or any concerns. We'll move on to our last value model, and that's going to be the physician practice model. This is an increasingly more and more popular type of job for an athletic trainer. I feel that we're doing very well in this certain setting. So we're going to kind of look at some of the things that the value model provides. So here we go. So the first thing is, demonstrating your worth and value with the best practices model. So once again, risk minimization, medical referral, care coordination, athletic trainers, evaluation and treatment of injuries, crisis management, same type of stuff that we've been talking about, but we do this in a physician's office. And then we're going to look at cost containment. So, rooming patients and obtaining vitals. This is something that an athletic trainer is very capable of doing. And then as far as, a thorough history for a focused exam, in the event that there is some type of injury, an athletic trainer can certainly take a thorough history, ask all the appropriate questions, and get a good idea of what's going on with this person or the patient. Assistance with documentation. We're very capable of documenting and preparing notes or any type of thing that a doctor may need. And then the application of cast, braces, splints, medical equipment. We learn everything in that nature when we're in undergrad, and then continue to do on our day-to-day basis in the event that there's an injury that requires one of those things. The final thing I think is one of the most important things that we provide is patient education in general, and then as well as the home exercise program. I feel that we're very capable of providing those, and I feel like we do a very good job. Continuing on, we'll look at the efficiency of athletic trainers in the physician practice. So this was some of the interesting information that I found while looking through the physician practice model. So research has supported that the financial advantage of an athletic trainer within a clinical model has been shown to increase by 18 to 22% when compared to a medical assistant. I felt like that's some pretty good data right there. And my first initial thought was, athletic trainers have a good idea on how to develop and move through a history and a physical exam pretty quickly and pretty thoroughly, as opposed to another healthcare professional, especially in terms of a sports-related injury. So then it went on to say the ATs have been showed to perform tasks more efficiently than residents, fellows, and other clinical assistants, which I thought was very promising for our profession, that we were able to act in an appropriate manner, act efficiently, and then also perform the task better than some of our other healthcare professionals that are valued and perceived as worthy professionals. So the tasks that were included can include history and physical exam, appropriate radiographs that are deemed by whatever injury it may be, and then presenting cases to physicians, teaching home exercise programs, and scheduling follow-up appointments. I feel like athletic trainers have a good rapport with physicians. I feel like we work with them on a day-to-day basis and develop a good communication pattern with them as well, and we're able to have a good dialogue between both professions. The last two things they looked at were patient satisfaction and then physician satisfaction. Going back to patient satisfaction, clearly it's pretty important in the healthcare profession. So that is becoming pretty widespread in terms of rating the patient satisfaction of the healthcare facility as well as the healthcare professionals in the facility. So they provided some information that patient satisfaction is equal to the patient perception of the medical staff. So that means if they have a good experience at that physician practice, they're more likely to say, yeah, I feel comfortable, I feel confident in that medical staff, which in turn helps the physician and the other healthcare professionals to, incur a balance and incur some revenue. And then, a good experience and outcome equals an increased chance of follow-up. So, physicians make their money off of insurance companies, and the more patients that they see on a day-to-day basis, the more revenue they incur. So it's always good to have your customers and develop a good relationship with them, and then continue to grow that relationship. And then, as in terms of physician satisfaction, this is also another common survey that goes out to all patients. So the survey to orthopedic physicians showed a high satisfaction with ATs in their own practice, which is very promising. Physicians rated the clinical skill set of an AT above physician's assistants, nurse practitioners, and medical assistants. And they were also highly satisfied with the AT skill set, and they make their practice more efficient and profitable. I feel those last two statements are some of the most important statements in terms of the in terms of the physician practice value model. It enables an athletic trainer to understand that they can work in this environment, and they're just as good as their counterparts. Moving on to our next topic, we're going to talk a little bit about tracking injury encounters and how that can help in improving your value and your worth. So athletic trainers typically use an electronic medical record or an EMR to track encounters with patients. It helps show the demand and workload of the athletic trainer, and this is something objectively that you can show your administration to say that I've seen X amount of injuries, or I've had X amount of treatments, rehabilitations on a year-to-year basis. And then, something that you always need to do is document everything that you do, especially when it comes to providing care for another patient. So you want to develop a daily encounter form to track each patient that comes through. So every time they come through the door, they should be signing in to, one, document that they were there in terms of any type of lawsuit that they may incur, and two, what treatment are they receiving. If they're coming in for an ice bag for a knee, they should document that. And then if they're coming in for a rehabilitation for a post ACL 2 months, that should be documented that they came in that day, just in case if you ever forget about it, there's something that says he came in this day or she came in this day, and then it kind of reminds you of what you may have done, and hopefully you document that day as well in the rehabilitation. So some things that should be included on the daily encounter form are the reason for the visit. Is it for preventative measures? Is it for an actual injury, an evaluation? Is it for a rehab session? The type of service that is being provided. So it can be if you're just coming in for a heat pack before you go out and run for cross country. It could be rehabilitation. It could be just stim and ice. Anything that they may want, they should probably put that down. What body part you're working on, and then determine if the injury is a non-time loss or a time loss injury. So this really helps when it comes down to determining if the athletic trainer is saving money for that place of employment. If it is a time loss injury, more likely than not, if there were no athletic trainer, they would be referred to a physician or a physical therapist to receive proper medical care. So in this event, it helps the athletic trainer's case because we are providing them a service that would typically have to be outsourced. So, for instance, a non-time loss injury would be a lower leg contusion in a football player or a field hockey player, versus an ACL rehab for a time loss injury in a women's basketball or women's soccer player. Okay, I just wanted to give a couple examples of using the EMR and the amount of injuries that you may encounter on a given year. So, for example, we'll be at a high school that has 500 student athletes. Pretty large high school. So, with the amount of sports they may have, we'll say there's 100 injury encounters a week, which would then equal 5,200 injury encounters a year, which would just be, seeing them on a day-to-day basis. That would not be including any type of treatment or rehab they were able to complete. But, just in light of things, that would be 5,200 injuries that would have to be referred to either a physician or a physical therapist within the area. So, when it comes down to that and you're talking to your administrations with secondary schools or colleges, there is value in numbers. And I feel like that's one of the most objective things that you can do to help yourself out is provide objective data on how you're helping the university, even if it's not visibly happening. You can show it through the numbers about how much money you're actually saving them. Kind of a joke from a MasterCard commercial a couple years ago. Visiting emergency department is $100 to $250 depending on your insurance. Visiting a family physician could be anywhere from $15 to upwards of $50 for a copay. Visiting your athletic trainer in a secondary school, that's priceless for the most part. There's certainly a lot of athletic trainers that are not billing for services. So utilize the value that they bring, and hopefully your administration values you as well. Okay, so we'll move on to the NATA salary survey. This was developed, I think, in 2009 or somewhere around there, and then it's continued, I think, every 2 or 3 years that they do another assessment. So I would say this is one small tool to portray your worth and value as an athletic trainer. So the reason I say it's a small tool is I think only 3,000 out of 40,000 athletic trainers filled the survey out correctly or filled it out in general. So there's definitely some skewed data due to the lack of participation. There's multiple variables associated with different jobs. So you can have the job as an athletic trainer for 20 hours a week, and then also you can work in the clinic for the other 20. Which can be confusing on what setting you're actually working in. And then there was inaccurate salary based on the job. There's athletic trainers that are business managers making 6 figures that are not completing it because they don't practice the profession of athletic training, but they still maintain their certification. There's CEOs of medical companies that are athletic trainers, but they're not filling out the survey because they don't practice athletic trainer. Okay, so we'll move into our decreasing injuries equals decreasing cost for patient or workplace. So these are just some things that can help prevent injury or decrease the risk of injury. So you want to initiate strategic exercise programs with your strength conditioning staff. If you do not, I would just go over some exercise programs that your coaches can take your team through in the dynamic warm-up that they may do, or the cool down at the end of practices. Incorporate injury prevention programs, and an example of this would be the FIFA 11 Plus. This is widely used in soccer, but can be easily changed for any other sport. Provide evidence-based literature to help coaching staff decrease injuries on their own. Anything you can do to help the student athlete or the patient to decrease their risk of injury would be important. So in the event that you have the chance to present your worth to your administration, the first thing you want to do is educate them on the skill set of athletic training. Some administrators don't necessarily understand what an athletic trainer may do, or what their value may be. They just might know it as the person that tapes an ankle or the person that gives people ice, but athletic training is far more than that. Hopefully I was able to display some of that today. But then you also, in that event, you would want to provide them with objective data that you're able to stand behind. So I would include things like the NATA salary survey, cost savings assessment, the AMCIA recommendations, things along those lines. And then also what I think helps is providing clear and concise graphs to convey your data. Some people are visual learners, so it's always good to portray your surveys and any type of other information that you may have, graphs, anything like that, into a presentation-oriented environment. Definitely include some visual, and then you just be confident about your profession. Okay, so the last thing we're going to look into is the return on investment. So return on investment is a profit realized from a resource minus the original and ongoing investment. The personal return on investment, what profit are you returning to the employer's investment? So let's say an athletic training is working in a physician practice. The athletic training is providing you with $120,000 of revenue while you're paying them $60,000. So that return on investment would be 200%. So they would be making 200% off of your hire. This is something that is valuable. The return on investment equation is what revenue are they generating divided by the amount that you're investing, and then you times that by 100. And that would be your return on investment percentage. Okay, so a little bit more on return on investment in terms of athletic trainers. So the NATA did a survey in 2008. 100% of companies reported a positive return on investment, with more than 80% indicating that return on investment was $3 for every $1 invested. So for example, return on investment was $150,000 for every $50,000 they invested. If you multiply that by 10, you're making a good amount of money for what you're investing. 85% reported numbers decreased by 25%. Almost 50% of companies reported emergency department costs decreased by 50%. 63% reported a decrease in workers' comp 6 months after the AT was hired, and then 96% after 12 months. So as you can see, athletic trainers help diminish some of these costs that employers may incur due to referring for medical services. The job duties for an athletic trainer in these return on investment situations can be educational, health and wellness programs they provide, injury prevention, ergonomic assessment, and then as well as stretching, first aid, CPR, nutrition, PPEs, injury management. This is a fairly old study, so I'd like to see some new research, but it's very promising, and I'm glad that our profession has gone that way. Here are some resources that help guide this presentation in the event that you would want to learn any more about anything that we talked about today. Here are some of the resources that were helpful to this presentation. Thanks for joining me for Student Research Week. I hope you were able to get something out of today's presentation. In the event that you have any questions or you'd like to start a discussion, please feel free to contact me on my email. I'd be more than happy to discuss anything pertaining to today's material. Thank you once again. Have a great day.